Hey everyone, welcome back to Pop Chat with me, Dr. Lavanya. Firstly, I want to thank you all for your wonderful responses for the last post in the form of comments on YouTube and also some messages in Instagram. So many of you gave the very right response. It was really fantastic to see from you all such a very nice response that I get back for a post. And it's really fascinating to know that many of you are also interested in medical history. So let's dive into the topic today about the answer for that extent. So it's time to reveal the answer. The answer to that chest X-ray is Plombage therapy. It's actually a kind of treatment used way before all these antibiotics started taking over the modern medicine. So this Plombage therapy was a surgical technique used to treat the cavitary tuberculosis. So this procedure was followed yearly back in 1930s or 1950s, where antibiotics were not evolved for at that time to treat tuberculosis. So what they did was that they used to create a cavity in the lung surface, usually in the upper lobe, and they fill that cavity with some inert material like some air or lucid balls or some ping pong balls, something like that. So that is that round shaped shadow that you see in the chest X-ray. So what was their idea behind this surgical technique was that the idea is just simple. They just believe that if we collapse that part of the lung, then the remaining healthy part of the lung will easily get healed, like it will get healed very fast. That was the principle behind the surgical treatment. However, this Plombage therapy came with a lot of risk also. There was severe bleeding, there is hemorrhage, infection, and there were fistula formation between the major blood vessels like aorta also. And there was also fistula formation in the esophagus. So being a very invasive procedure, it takes a lot of time to get recovered, and for the infection and monitoring time is also more. So thanks to antibiotics for revolutionizing the treatment of tuberculosis by giving just simple antibiotics rather than such an invasive procedure. And drugs like streptomycin, rifampicin, isoniazid, all of these was really a revolution. And recently there is a new regimen for a multi-drug resistant TB where we follow B-PAN regimen, which stands for bedaquiline, pritomanid, linezolid and moxifloxacin, which has really revolutionized and have a better improvement and better treatment results compared to the surgical invasive procedure that we have been using for long before. Thanks to antibiotics that we have not just saved countless lives, but we have also reduced the global burden of TB. So next time when you hear about tuberculosis treatment, remember this historical invasive procedure of Plombage therapy and how it evolved to the antibiotics that we are using now with new recent regimens evolving on. So hope this historical treatment surprised you. Let's meet next week with more interesting topics. Bye.